This is the Human Action Podcast, where we debunk the economic, political, and even cultural myths of the days. Here's your host, Dr. Bob Murphy.
Alex, welcome to the Human Action Podcast.
Great to be here, as usual.
Well, folks, just to give you a bit of the framing here, so when I saw that Trump was issuing an executive order on drug prices, I thought, I got to talk about this for this week's Human Action Podcast, and I knew that Alex here is the health economist that knows this stuff way better than I do. And what may be even extra interesting, folks, is I think Alex and I possibly might disagree, or at the very least, I'll be in a position to play devil's advocate in case, his particular reaction maybe is not what some of you may think. But I think no matter what, by the end of this discussion, you're going to understand the issue a lot better. And so, Alex, maybe just to motivate this, let me read some excerpts from the executive order that was issued on May 12th, delivering most favored nation prescription drug pricing to American patients. Section 1, the purpose. I won't read all this, folks, but I'll read some of this in the beginning to motivate it, and then I'll jump ahead to the meaty part. But here's the overall purpose. The United States has less than 5% of the world's population and yet funds around 3/4 of global pharmaceutical profits. This egregious imbalance is orchestrated through a purposeful scheme in which drug manufacturers deeply discount their products to access foreign markets and subsidize that decrease through enormously high prices in the U.S. Okay, and it goes on. This abuse of Americans' generosity, who deserve low-cost pharmaceuticals on the same terms as other developed nations, must end. Americans will no longer be forced to pay almost 3 times more for the exact same medicines, often made in the exact same factories. As the largest purchaser of pharmaceuticals, Americans should get the best deal. Okay, and then some particulars, like for example, Section 4 of this says, enabling direct-to-consumer sales to American patients at the most favored nation price. So he's saying, to the extent consistent with law, the Secretary of Health and Human Services shall facilitate direct-to-consumer purchasing programs for pharmaceutical manufacturers that sell their products to American patients at the most favored nation price. And then there's a long section here about how exactly are we going to establish the most favored nation pricing, one of the components of which seems to me, and I'll just summarize this, and then I'll let you go ahead and react to all this, Alex, that it was unclear whether it was literally, is the federal government going to be telling pharmaceutical companies what price they have to charge? But it looks like at least one thing in here is to say if pharma companies in the administration's view are not charging the fair price, they'll just allow importation of the drug. And so it seems like right now, that's, I think, one of the issues is, would you have something selling at a much lower price abroad? Why doesn't some firm just import all that cheap stuff and sell it to Americans? And right now there must be some roadblock. And it looks to me as if this executive order is saying, at the very least, we will lift that barrier to make sure that Americans are not paying whatever it is 3 times more for this, quote, exact same drug as somebody in Europe is, or whatnot. Okay, right. So I'll stop there and go ahead, Alex, take it away.
Sure. So the irony here is that Trump wants to stop imports from all over the world, except he wants to import price controls from Canada. So basically, that's what's going on. I think there's a lot to react to. One broad thing, which I think bothers me about both the Biden administration and the Trump administration, it's all about being victims. That the United States is a victim. The United States has been ripped off by other countries. That's what Trump says when it comes to trade. Mm-hmm. Our deficit proves we've been ripped off. Other countries are stealing from us. And now that's what he's saying about price controls. We're subsidizing other countries, and they're taking advantage of us. Okay, and the reality, of course, is the United States is the world's richest economy. It's the world's biggest, richest economy. GDP per capita, median wages, they're all up. The United States, nowhere else would you prefer to be, than in the United States. All of these countries which are ripping us off, okay, and yet citizens from those countries, they want to come to the United States. Of course, Trump doesn't want that either. Doesn't want immigration either. But all of this victimology, I think, is very dangerous. And it's all about, the big picture is all about dividing the pie. We have to do more redistribution. Again, just like the socialists, just like the left. all about redistribution, okay? Other people are ripping us off. The billionaires are ripping us off. We need to take money from them and give it to the poor or something like that. And Trump is just the same thing, except that the people he wants to take from, are just different classes of people, people in other countries maybe, and that they're ripping us off. We want to, we have to get back. We have to get back at them. And the danger, of course, in both cases is that by trying to do more redistribution, you reduce the size of the pie. You shrink the pie. And I think that's what Trump is. I don't know if this executive order actually means all that much. Trump throws these things off daily. But I think that if it were put into place, it indeed would shrink the pie. In particular, it would make Americans less healthy. It would give Americans less access to new drugs, which is incredibly important. So I think the net effect would be very bad if this went forward.
Okay, so, and we're going to unpack all this stuff, folks. What's interesting is I know there is a large segment of the MAGA, especially the ones that like the term MAHA, Make America Healthy Again,
right?
That they're very skeptical in general about pharmaceutical products. And so what's interesting, it seems like a weird tension where on the one hand, in other words, they might think that you're being naive and like, oh no, they're just coming up with all this stuff that we don't need. If everyone would just start eating natural foods again and let your kids run around outside, a lot of these things would go away. And I'm very sympathetic to that, approach. But what's interesting is it's like, okay, so then isn't it a good thing if Americans can't afford to get these drugs that you're saying are bad for that? You know what I mean? So it's a weird
Yes.
tension on the surface. So let's just go for the purposes of this conversation, which I know you agree that to assume in general, new products that pharmaceutical companies are bringing to the market could help at least some segment of the population. And so we don't want to interrupt the discovery and delivery of these new products.
Sure.
So, but before we get too deep, is it true, Alex, that Americans in general are paying, like there's this tiered system where the big pharma companies, they have a lot of R&D costs, and the way they deal with that is they charge a lot higher price for, quote, the same product to Americans than they do selling the same pills abroad. Is that basically true?
Yeah, partially it's true. So the true part is this: for drugs which are on patent, branded drugs, they are more expensive in the United States than elsewhere in the world. And yes, the reason is that indeed we have more of a free market. Putting aside the patent, we can debate patents, but putting aside the patent, we have more of a free market in the United States than in other countries. So other countries put price controls on these drugs. So to a certain extent, you can argue that other countries are so-called free riding, taking advantage of the fact that these drugs have been created. I wouldn't call it a subsidy because we're not actually paying anybody anything. But the United States is just the world's richest economy. People are willing to pay for these drugs. That funds the research and development. And other countries, of course, benefit from the research and development in exactly the same way that, other countries benefited from, us having Edison, invent the light bulb. These are products with very high research and development costs and low marginal costs. So the way I put it is, the first pill cost $1 billion. The second pill cost 50 cents. So when you have a product like that, one of the few ways that you can support all of that research and development is to so-called price discriminate, okay? Which just means to set different prices for different people. So the United States is rich. We have a high price. Other countries are poor. Now, if you went to those other countries, Africa, less developed countries, okay, which is the rest of the world, they're poorer than the United States. China, India, these are poor countries. Even European countries are considerably poorer than the United States. If you went to these countries and said, you must pay the same price as U.S. citizens pay, they wouldn't buy any at all. Or they'd buy much, much fewer. And in fact, that would reduce the profits of the pharmaceutical companies, and that would be worse for people in the United States. So the fact that we can actually say, okay, look, we'll give you a lower price. We're not going to make so much profit, but we'll make a little bit of profit, and that will still help our bottom line. That actually helps people in the United States. So setting different prices in different parts of the world actually raises the profits of the pharmaceutical companies, which is good for research and development, which is good for the United States. Now, it's also true that they impose price controls and they do more of that as well. But the bottom line is, forget about the rest of the world and complaining that you're a victim and we pay higher prices than them, blah, 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 blah. The question is, do we get value for our money? And despite debates about MAHA and, natural foods, all that kind of stuff, Americans have shown they want to buy these drugs. They're very happy to buy them. Well, they are willing to buy them at the high price because Americans want to save their lives. They want better lives. And the pharmaceutical companies, the pharmaceuticals actually do provide that. And for that reason, we have insurance. Okay, so it's not actually that most Americans, they're not being priced out of these drugs. They're paying a high price, but they pay it through insurance and the price is paid. So yes, we have high prices. Second point, and then I'll stop. We have them for like 15 years. Okay, that's basically the amount of time that the patent lasts. At the end of 15 years, these drugs go generic, prices fall, and the United States has the lowest prices for most pharmaceuticals in the world. Let me say that again. The United States has the lowest prices for most pharmaceuticals in the world because most pharmaceuticals are generic. So we have a tiny number of relatively new drugs which have been produced in the last 15 years. Those drugs are expensive. We have a huge number of generic drugs which have been produced over the last 200 years. Those drugs are very cheap, and they're cheaper in the United States than anywhere else in the world.
Why, on that last, why are they cheaper here?
Well, we have a very competitive generic market, and we did something pretty smart with the Hatch-Waxman Act many years ago. We said when a competitor drug, when the patent expires and we open the market up to the generic drug, the generic drug does not have to redo all of the safety and efficacy trials of the original drug. All it has to do is prove that it is equivalent. So if you just prove that it is chemically the same thing, then you are free to sell it in the United States. And we have a big pharmaceutical market, and we have lots of competition, and prices are, for most drugs, the U.S. has the lowest prices in the world.
Why don't the other countries import from us then? That's all. I'm just getting a little side point there. Okay.
Yeah.
Okay. So good. So let's unpack a bunch of that stuff in turn.
Yes.
So on the notion of just price discrimination. So that's what's interesting about this is I suspect, because I read and folks will link, Alex had a long blog post on this stuff, that you weren't necessarily disagreeing too much with some of the main claims of that, Trump's White House executive order. It's just you're saying, yeah, and that's a good thing. Like, yeah, there is price discrimination. That's what we would want. And so maybe let's switch to something that's less hot button.
Yes.
Like movie theaters. Like that's the example I like to pick. That, yeah, do you realize that they charge a higher price on Friday night and Saturday night than they do at Wednesday matinees? That, is that, that's, you say it's price discrimination. And I would say that's a good thing, that if they passed a rule saying movie theaters had to charge the same price regardless of the date, the day of the week, and the time, that would hurt moviegoers in the long run.
Exactly. And they give senior discounts.
Yeah. Right. Senior discounts. Right. And this came up, Alex, when the surge was like, people were saying Wendy was or somebody was doing surge pricing with like drive-thrus. And so anyway, I'm just saying in general, that kind of issue. And again, the point is, given that they're going to build a building and be able to house a certain number of seats on Friday and Saturday night when it's going to be packed, and how much they're going to charge. Well, now Wednesday, when a few, mom with kids that don't have school that day are going to take their kid or something, you don't need to charge $20 a head. That's crazy, right? And so as long as you can cover the marginal costs, and I have a few kids
Absolutely.
at the selling popcorn and taking the tickets or whatever, it makes sense. And the fact that the theater can do that and make some more money, given the building's just sitting there and the seats are empty anyway, you might as well make some more. That actually lowers the price for the Friday and Saturday tickets in the long run because more theaters can come in the industry, blah, blah, blah. Okay,
Exactly.
so
the example that I gave is that we're all familiar with is airline flights, right? So we all know, you could be sitting next to someone and you might have paid twice as much or half as much as them because the airlines, it's all marginal cost. The flight is probably going to go anyway. So, they try and in a variety of ways, if you book 2 weeks in advance, if you stay over a Saturday, they'll give you a lower price, things of this nature. And the point of that is if the airline just said one price for everybody, it would be less profitable, okay, and more expensive for a lot of people, okay, and it would mean that they would be able to support, fewer flights. There would be a less complete network, right? Mm-hmm. So the fact that they can charge different prices for different people actually tends to support the entire network of the airline system.
Okay, and so then one of the things, though, that needs to happen for price discrimination to be an option for the seller is it can't be easy for the people who buy at the low price to just resell to the other people. So like for airline ticket, the guy who buys his seat at $100 can't just sell that to somebody who paid $800 and then, that, or the movie ticket, the person who goes to the Wednesday matinee can't just sell that ticket to somebody else who takes it and then redeems it on Friday night and it still works there because then that defeats the whole purpose. Exactly. And so likewise, if people are at least open to the idea that it could make sense that for a drug company that, like we're saying, has to spend $1 billion up front figuring out the formula, going through all the tests and everything so it can legally sell it in the U.S. market, then to say, oh, given that we went through all that, now, on the margin, it only costs 50 cents a pill. We can make an extra $200,000 a year by mass producing it and selling it at, $1 a pop for this country over here. But for that to work, you can't allow some company then to mass import from that little dinky country over here and sell it to Americans at $5 a pill because then, you don't do that. So that's the general logic?
Yes, okay. Absolutely. And notice that if you did allow reimportation, I mean, it's tempting, right? You would think, oh, Americans can get much cheaper drugs just by allowing them to reimport them from the poorer country where they have the lower prices. Well, if that happened, of course, the pharmaceutical companies would not sell the drug at the lower prices to the poorer country. They just raise the price for everybody. So in trying to grab up that lower price, the U.S. would end up being no better off. Prices would be just as high, and people in poorer countries would be worse off. So, and the pharmaceutical companies would be worse off. Their profits would be lower. Who cares about the profits? Well, we do care about the profits because that's what generates the research and development. So that in trying to grab up that lower price, the United States would end up hurting the rest of the world, especially, but also hurting themselves.
Okay, and it's interesting. I don't know if you read it, but I know Thomas Sowell covered this case, this example. I think it was in his book Advanced Economics, as opposed to like the Basic Economics book. And then he made the point you just did that. Yeah, it's tempting to think if we just allowed for the reimportation, then it would bring the price down here. But no, it's the other way around. The pharmaceutical companies realizing that's the issue, then would just stop selling at the low price abroad, and it would. And so, am I correctly inferring your position, Alex, that you're saying it's analogous to, these leftist progressives who see a bunch of billionaires walking around and say, oh, why don't we just take 90% of their wealth? I mean, they'll still be rich. And then, you could do that, but at best it would be a one-shot thing because then that, they would stop generating that wealth in the first place. And then that hurts everybody. So likewise here, it looks like there's some low-hanging fruit. We got these pills selling at $1 a piece abroad and Americans are paying $50 for them. But if you allow that to come back in, all of a sudden that would disappear.
Yeah, exactly. I mean, that goes back to the point I made earlier in sort of general terms. When you spend all your resources to divide the pie gets smaller. Okay.
So, you've laid out the case how you could imagine in a market, it might make sense. And in movie theaters and stuff, they're not running to the local mayor and getting all sorts of price controls and other restrictions. This is just a market phenomenon to have price discrimination. But does it it all complicate the story that, Trump's talking about price control, and you said it as well. It's not simply that, oh yeah, these are all market phenomena, and they go ahead and measure the price elasticity of demand for various products in different regions and set the thing according to where, you solve the calculus problem and it's optimal. No, it's foreign governments are engaged in explicit price controls. Doesn't that make this a little bit of a weird thing for a free market economist to be championing?
Yeah, I mean, I think there's some truth to that. And so the question is, how do you deal with the fact that other countries have these price controls? And I think there's ways of doing that. So, but ironically, okay, so this is the steel man, all right? Mm-hmm. The steel man of the Trump policy, which some smart people will say is actually what's going on. I don't think that's correct, but let's just steel man it. Is that what we're really trying to do is not to reduce prices in the United States, but to raise prices in other countries in order to increase the profits of the pharmaceutical companies, generating more incentives to do investment and R&D, right? Mm-hmm. Now you can see why nobody wants to say that out loud. Right. But, okay. I don't actually think that's what's going on, but that would be the best case. Now, is this the right way to do it? No, not at all. This is a crazy way to do it. Okay. Again, to import other countries' price controls into the United States is not a smart policy, in my view. Now, if we want to solve this issue of increasing global research and development, okay, we want to increase the incentives to do research and development globally. Okay, then the way to do that is painful, ugly, time-consuming, and it's to have a bunch of free trade deals. Have a bunch of trade deals, and then you get the lawyers on it, and you work at it, and it's ugly and it's horrible, and it's all kinds of rent-seeking going on. But that is basically the way to do it, and we have done that in the past. Okay, so we have a 2005 free trade deal with Australia. And part of that deal is that Australia agreed that they will respect, to a greater extent, American patents or patents on pharmaceuticals, and they will have higher prices. Now, of course, they don't want to say that in Australia, but that was the upshot of the deal. And that makes sense, okay? I think if that's what we want to do, there are ways of doing that. There are ways of putting pressure on other countries to contribute to research and development expenditures. I think that's pretty secondary. Like, it would be good, if we do it. But we got to keep our eye on the big picture, which is, are these expenditures worth it for U.S. citizens? And absolutely they are. So all of the evidence indicates, and maybe this now gets controversial, but all the evidence indicates that the United States does very well. It gets the pharmaceuticals, not only it gets them first. Everybody wants to come to the United States because we do have high prices. We get pharmaceuticals early. We get the best pharmaceuticals sooner, okay? And they save lives and make lives better. So the investment has a very high return ratio in terms not just of, I think about it this way, not only do these pharmaceuticals save lives and make lives better, they can actually reduce healthcare expenditures, okay? Because think about it. What would you rather do? Treat somebody for, high cholesterol with a statin, or have them do a heart operation? Way, way cheaper to give them a statin, which are incredibly cheap drugs. Give them a statin and not have them be hospitalized for an operation. These operations are very expensive. So not only could these Trump-Biden policies, and remember, this is just an extension of Biden's policy of price controls, which he put into the IRA, the Inflation Reduction Act, which I was against then, okay? So this is not a case of Trump derangement syndrome, okay? I was against it when Biden did it. I was against it when Obama tried to do it. I'm against it when Trump does it, okay? So
if you did have it, though, there probably should be some drug that you could take.
Yeah. Well, the irony is that Trump derangement syndrome happens on both ends of the spectrum. Okay, there are two types of people who get it. But my point is that not only could this policy make Americans less healthy, it could actually raise healthcare costs. So by reducing the cheapest part of our healthcare system, by making the cheapest part of our healthcare system less effective, we could actually shift people into the substitute, which is hospitalization, which is much, much more expensive.
Okay, let me take one last shot on this particular area where we're discussing, and then I want to switch over to like this ostensible fact that, it costs $1 billion to bring a drug to market, because I don't think that's a fact of nature, and we can talk about that. But
yes,
right, while we're still on this particular issue, again, steel manning, couldn't somebody say something like this? Like, hey, maybe it's a case-by-case basis, but in general, Alex, what's happening is, or I'm open to the idea that these big pharmaceutical companies, when they go and figure out what they're going to sell for in these other countries, and the government's there playing hardball with them, and no, we're going to, you can't sell it more than blah, blah, blah. And they just go along with it because it's fine. Whereas if Trump now says, whatever, and in the executive order, he said something like among developed countries, right? So it's not necessarily like some really super poor African country. It's like, if this big U.S. pharmaceutical company is selling in Germany at this price, then you have to sell it to Americans at that price too. And that, as your point is saying, what's going to end up happening is the prices in Germany are going to rise. But isn't it conceivable, at least, that when the dust settles, because that original price that was being charged in Germany was not the profit maximizing, price discriminatory level based on the calculus, but instead was partly because of the German government or labor unions or whatever the heck was going on over there, that it's actually the new equilibrium that involves higher prices in Germany. It could still have somewhat lower prices in the U.S., and the pharmaceutical companies still actually make roughly the same level of profit. So it's not impairing industry. Like, isn't that possible, given that we're not starting from, true free market and deviating, that we're starting from a messed up regular, price controlled system anyway?
Yeah, it's definitely conceivable. And this is what, a lot of people, I think, were fooled, on the libertarian or the right when it came to, trade policies. What Trump is actually doing is, 4D chess, and, he's going to come up with a deal, and the deal is actually we're going to have more free trade. Right? So it's only temporary. The tariffs are only temporary. This is to open up the markets, in these other countries and get them to lower their tariffs, and we're going to have more free trade. And of course, that's all total bunk. None of that happened. The fact of the matter is that every opportunity Trump has to indicate he's playing 4D chess, he just comes says some crazy mercantilist thing, straight out of Adam Smith, straight out of the opponents of Adam Smith. Trade deficits just show that we're losing money. I mean, as you know, Trump literally said basically the fact that there was less ships in the port. Well, that's a good thing. That shows we're losing less money.
Right.
Okay. So, yes, you can always take a smart person, super smart person, and they can wind their way through the forking path to find out some way in which this could almost magically create, a better situation, closer to a free market situation. So it's not out of the question, but is that what is actually going on? No, I don't think so. And I think the clumsiness and ineptitude in which this is done worries me that, in fact, we will end up with a situation where, the total investment declines. And of course, that's what the stock market indicates. The stock market, the prices are coming down of the pharmaceutical companies. They're worried to the extent that they think that this is going to go anywhere. All of the stock market indicators indicate that this would be reducing the profits and therefore the incentive to do investment of the pharmaceutical companies.
Okay, so Alex, just to refresh people's memory, I think one of the pillars in your argument was, hey, we can talk about in a second why this is the case, but right now there's this big upfront, say it's $1 billion to bring this major new drug to market. They have to be able to charge it and recoup their cost, and so Americans are going to have to pay high prices. But you've said it's only temporary, right? Because once the patent expires on that, then it goes generic. But you do need that upfront period of patent protection. Otherwise, again, why would anybody engage in that? So just, can you speak a bit, are you in favor of that? Because I know, like, for example, Stephan Kinsella famously has written about, he thinks intellectual property per se is invalid. And, that's a confusion. And then, he understands people say, wait a minute, well then why would anyone write new songs? And, he has a lot of arguments for that. But in general, did I correctly summarize your position as far as like how IP works in this realm?
Yeah, no, I think that is correct. And yeah, there's definitely a debate to be had on IP. I actually tend to be, in my book launching the I forget what it's called, but
how are you going to protect it if you can't remember the title?
Yeah, exactly.
Someone's going to pirate that thing.
I've argued. The point is, I've argued for that IP went too far, and we ought to reduce IP. We're too far on the Tabarrok curve. If you Google the Tabarrok curve, you will find it is all about, just like the Laffer curve. Mm-hmm. There's a Tabarrok curve for IP, and I say we're probably too high on the IP. That is, we could reduce IP and increase innovation in some cases.
Okay. Now, because even on its own terms, like obviously the 15, like why isn't it 15 seconds? Why isn't it 15 decades?
Exactly.
You know what I mean? Like that's kind of arbitrary.
Absolutely. Yeah, absolutely. And, we have made these adjustments over time, which I think has been reasonable. One which I mentioned earlier was like, you get your patent before the drug is marketed. So it was the case that the actual patent times were shrinking, that you were on the market because you're researching and developing it. You get the patent, but you're still not approved. It takes you years to get approved. Meanwhile, your patent is running down. So we added a few extra years on, and I think that was a smart thing to do. So anyway, the point is we can make adjustments. Second point is, whatever your perspective on IP, everyone agrees pharmaceuticals are the hardest case, okay? So everybody agrees that, whatever you think about copyright or, patents on software, pharmaceuticals are really the tough case. Because it is the case that the formula costs you a lot, whether it's $1 billion or not, okay, it costs you a lot, and the marginal cost of, once you know the formula, is very, very low. So pharmaceuticals are the case for IP, for patents. Now, this raises the issue of what else could we do, okay, to reduce the costs of new pharmaceuticals. And as you know, I'm a big proponent of reducing the FDA rules, okay, and making it cheaper. So I think that's one thing we could do. Another thing we can do, which I think is very interesting, again, because it shows you sort of the inconsistency of a lot of current policies, both this administration and previous administrations, is that have closer ties with China. Because here's the thing, in the 1970s, when China was one of the poorest countries in the world, okay, they weren't spending any money on researching and developing new drugs because 90% of their population was poor agricultural farmers making literally $400 a year. So of course they're not going to be investing any money in researching and developing anything, let alone new drugs. As China has become richer, they have invested more and more in creating new drugs because the Chinese are now dying of cancer. They're not dying because before they were dying of starvation. They didn't live long enough, to get cancer or heart disease. Now they're richer, they're getting cancer and heart disease, and they're starting to invest a lot of money in that. And that is great. That is great for us. As I say, if an American creates a cure for cancer, I'm going to be delighted. I'm going to be thrilled. If a Chinese citizen creates a cure for cancer, I'm going to be 99.9% as thrilled, okay? Because that is in the nature of ideas that will be available to everybody in the world. So precisely, if you want other countries to contribute to R&D, you have an interest in making other countries rich. Poor countries don't contribute to R&D. It's the rich countries that contribute to R&D. So we want the entire world to be rich. That would be the best case. And again, think about scientists and engineers. Again, in the 1970s, under communism, there's no scientists and engineers in China to speak of. Now that they're much richer, many, many more people, highly educated, smart people, they are researching and developing because they got a lot more scientists now.
There's a bunch in Wuhan.
As a bunch in Wuhan. Okay, thank you. Yes.
I had to. Okay.
And again, that by and large is good for the United States in a peaceful world.
Yeah. Okay. Very good. So can we just unpack? Because again, I'm trying to not throw you to the wolves here with the people that just like, oh, how can this guy be missing this stuff? That you are a very big proponent of the case that the FDA is one of the main things that's unnecessarily making prescription drugs expensive for Americans. Is that a true statement?
Yes, I think the FDA has created drug lag and drug loss because of all of the rules and regulations it requires to get through safety and efficacy trials. It has increased the cost of producing new drugs, and that has meant we get new drugs later. They're delayed. Mm-hmm. And it also means that some drugs cannot reach the hurdle. There are some drugs people say, well, it's just not worth it. The market is too small. Okay. We are just not going to invest time and energy in trying to produce a drug for this disease. It doesn't affect enough people to make it worthwhile to spend that $1 billion. Okay.
What would you say to somebody, though, that is like, well, geez, Alex, we don't want to. So here, not necessarily the listeners to the Human Action Podcast, but I could imagine just a more, normal cross section of Americans would say, whoa, but there's a reason we have those protections, like, thalidomide and all this kind of stuff that, yeah, it would bring down the prices if we just got rid of it. But geez, by the same token, if we didn't certify brain surgeons, it would be real cheap to get a brain surgery, but it'd be from, your local plumber or something. That's crazy. So just in general, those types of fears, what would your response to that kind of a thing?
Right. So I guess I have more faith in the consumer, that consumers care about quality. But also, look, you just got to think on the margin, okay? So the problem that we have is that if the FDA approves a bad drug, a drug like thalidomide or whatever, kills people, okay, heads will roll. There will be congressional meetings, okay? People will lose their job. There'll be a big hullabaloo. Just look at thalidomide. This is now, more than 50 years ago, and people still bringing this up, okay? Mm-hmm. Right? On the other hand, if the FDA says, well, let's just run some more tests, okay? Let's just ask the pharmaceutical companies or tell the pharmaceutical companies they need to run another trial. We're not sure about this. You better have the trial better be larger, okay? Get some more people in it, and we better make sure that there's, African Americans in the trial, as well as Indian Americans and white Americans. We want a big trial. Everyone, has got to be in there. If they just say that, no one knows. And you delay the drug. You delay a drug which could have been saving lives, okay? What happens there is what I call the invisible graveyard. People still die, but they are buried in an invisible graveyard. People die because they don't have access to the drugs which could have saved their lives. But they're unknown, unlike the people, born because of thalidomide with the seal problem without limbs. The people buried in the invisible graveyard are unseen. So I like to say economists can see this because we have practice in seeing the invisible hand, so we can also see the invisible graveyard. But we're one of the few people who can see the invisible graveyard. So if you think on the margin, think about the incentives that the FDA has. They're much more heavily weighted towards avoiding putting out a bad drug onto the market than they are on thinking about what if we delay or make too expensive a good drug. So that's all about on the margin thinking which way we have to move.
Mm-hmm. But also, so yes, there's definitely sins of omission where they refrain, they're too conservative. But then the research I was doing for the book, The Primal Prescription, that I did with the ER doctor, Doug McGuff, there's also the flip side thing too, that when you do have the FDA is the gatekeeper, if they do approve a drug and then evidence starts mounting that, oh, wow, they should not have approved this, there actually can be cases where they're very reluctant to admit they were wrong, because then it's like ex post, oh, so all these, 10,000 people that died, it's because you guys screwed up. And so it's kind of like the worst of both worlds there, as opposed to like a system of just competing, independent ratings agencies or, like Consumer Reports for drugs. And if one of them tells its subscribers, yeah, our people looked into this and we think it's great, and it turns out to be bad, then, its competitors can say, yeah, we don't think our subscribers should use that because there's all these problems with it.
Absolutely. Yeah. So I'm much more in favor of a Consumer Reports model for the FDA and in general to look to other sources of authority in terms of new drugs. What is your HMO, like a Kaiser? What do they think? What does the peer review literature think? To get what do hospitals think? What do the insurance companies think? The insurance companies actually are, an approval authority, right? Mm-hmm. And yeah, I do think that, again, it's a little bit ironic, as you were pointing out earlier, that we are so focused on getting the new drugs, which I on average, new drugs are better. They save lives. We have data on this. Okay. But we also have less experience with the new drugs. So if one is concerned about safety, get an older drug, get a drug where there's much more experience in prescribing that drug, and, use that. I think that's fine. Mm-hmm. I'm not against that.
Since we brought up the thalidomide thing, the other quirk of that thing, just to show how goofy all this stuff is, my understanding is that it was in the wake of the thalidomide scandal that they introduced not just the safety, but the efficacy requirement for the FDA, new approval, which had nothing. It wasn't that
Correct.
The problem with thalidomide was that it wasn't effective for, was it curing morning sickness? Is that what the reason women were using it?
Yeah, helping. Yeah, exactly.
So it's not that, oh, hey, in other words, it's kind of like when there's, a mass shooting and they pass gun control laws that wouldn't have even applied to the particular gun that was used in the shooting or something, so, hey, we got to do something because everyone's mad, when it actually wasn't even directly tied. Last one on this, the drug stuff that I want to ask you about, Alex. I know there had been a push. Is there a thing right now where there could be drugs that have been approved in, advanced European countries, but yet if they want to sell it in the U.S. market, they got to start from zero and go through the whole thing? And wasn't there some sort of move in the last few years to allow for reciprocity? Yeah.
So I've been a big proponent of that. I think, if a drug has been approved in the European Union or the UK or Japan, Canada, it ought to get at least first draft approval here as well. Like if I'm in Germany and my German doctor prescribes this drug to me, I don't say, well, hold on, has this drug been approved by the US FDA? Right. Mm-hmm. Nobody in Germany says that. So if it's good enough for the Germans, it's good enough for me. So there are drugs which are approved in other countries which have not been approved here, including as well things like a famous one is actually sunscreen. Okay. So the rest of the world has much better sunscreens than we do in the United States. They're more effective. They go on easier. They're less greasy. People use them more. Okay. So people, when they go to Korea, when they go to Europe, they often stock up on sunscreen and bring back some of the good sunscreen into the United States. And this is interesting because even somebody like, AOC, Alexandria Ortega-Cortez, she has been in favor of improving the sunscreens in the United States, letting more into the United States. So, yeah, I think we should do that. Ted Cruz had a bill with Mike Lee to promote that. It hasn't been passed as far as I know, but I mean, there are lots of things which the Trump administration could do to not simply lower drug prices, but to improve the case for pharmaceuticals in the United States, which don't involve price controls.
Mm-hmm.
And I would be very happy if the Trump administration did some of those things.
Okay. And I suppose actually just occurred to me, another element in this stuff too that we haven't explicitly addressed is just the need to have a prescription before you're allowed to buy something. Like I remember Tom Woods and I did a bunch of cruises for our Contra Crewman podcast. And like if we were in port in Mexico, there were people who would go to the pharmacy and load up on stuff that, oh yeah, in the US, you got to have a prescription to get this. Whereas there, you could just walk up and get the stuff. So it was probably partly cheap because it was Mexico, but also the other issue was just you don't need the doctor to give you a permission slip to go buy this thing. Absolutely. And so I guess that's a big element as well that kind of control, like preventing American consumers from getting their hands on something that, they've done their research and they think, yeah, I'm an adult, I want to take this.
Yeah. Yeah. So there's that. And I mean, there's even, one of the ones which just annoys me to no end. I wear contact lenses and every year, I have to go back to the optician to get a new prescription. I got to pay for a new prescription to get new contact lenses. Okay. Even if I don't want to change my prescription. Mm-hmm. Right. But by law, you cannot buy contact lenses unless you have a prescription which is less than 1 year old. So even if you don't want to change your prescription, they force you to go back every year to pay time and money to go to the optometrist to get a new prescription. And in Europe, you can just buy them over the counter. You can even buy them at vending machines. You could buy contact lenses at vending machines. So we don't even have to talk in some cases about, Mexico or Thailand or something like that. Mm. In Germany or France, you can get new contact lenses without requiring a new prescription. And I have actually pushed that with the Trump administration. I hope, again, that he could change this law. This would be much better than what they're doing with price controls.
Okay, that's good. It's funny on that. I know someone who works in the healthcare industry, in particular in the issue of supply chain management for contact lenses. And there was something after Brexit occurred where like they're packaged here and they ship them over there. And it was like it was like a project he was assigned to and just had to oversee like a 6-month thing in terms of getting the labeling right, because it was going to be the thing that once this particular thing, because it was like the Europeans reacted to Brexit in a way to kind of shut them out. Like, oh, okay, well then screw you. And so it was like all the labeling, like it was the same stuff, but the labeling all had to be different and blah, 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 because hey, it's stuff you're putting in your eye. You got to make sure, it's good stuff. And so anyway, it was just hilarious. It was like what a huge pain it was when it clearly was not making anybody's eyeballs less susceptible to injury. It was just a complete bureaucratic thing. So, I guess the last point here, Alex, just to circle back, have you heard the proposal? Maybe you even authored it for all I know about, I thought it was a neat way to kind of handle the critics to say, look, you can still have the FDA and everything, but why don't you just make it voluntary, right? So in other words, if there really is this segment of the U.S. public that feels very strongly about, no, we need guidance from the FDA because how would we know what drugs to use? I don't want to just go Google and look for stuff. That, okay, so the FDA could just go ahead and label stuff, but then for people who wanted to do their own research, and it could just be clearly marked, like in the pharmacies, there could be different sections and say this stuff is all FDA approved and went through all the trials and blah, blah, blah. And this stuff over here, buyer beware, this is not FDA approved. And you let the consumer, don't let kids buy it or something, whatever you want to do. And I like that move just because rhetorically it kind of made the person admit, like, no, it's not just for me or whatever. Like there's some people that I don't trust them to make decisions. Yeah. And we're going to decide for them.
No, absolutely. That's what I call the Consumer Reports model. So Consumer Reports says, here, this is good, and here are the trade-offs, the price, quality has this, it doesn't have this. But Consumer Reports doesn't say you cannot buy this product, okay? You don't have to, get Consumer Reports approval to sell a product in the United States. But you do have to get the FDA's approval to sell a drug in the United States. So, yeah, I think a model in which the FDA thought of itself more as how can I help consumers to make good decisions instead of how do I make decisions for them.
Yeah.
And I think the FDA actually could do valuable work there, right? Because the FDA, as a ratings agency, they absolutely could help consumers, provide them with information to help them make better choices. And I prefer thinking about the role of a ratings agency like the FDA as helping consumers to make better choices rather than making choices for them. So, I would certainly support moving in that direction.
And just to be clear, I'm just piggybacking on our earlier discussion. All I meant with this is as opposed to framing it as, let's get, radical libertarians, get rid of the FDA. It's stupid. We don't need it. But for somebody who that freaks them out to say, okay, we can keep the exact same apparatus. They can still have the 10-year trial periods and efficacy and third rounds and blah, blah, blah. And if someone wants to go through all those hoops and they can have that label slapped on them, all we're saying, though, is you don't have to do that. So keep that whole same apparatus in place if you think that's so important, but just give people the option if they happen to disagree with you. And then that usually kind of separates, the statists from the people concerned about public health.
There's other intermediate positions as well. So something, again, I have supported is a ranking system where the FDA says, okay, this is A. These are the A. These are the Bs. These are the Cs, and they sort of rank the quality of the information on safety and efficacy and so forth. And there actually was a little bit of a move in that direction, but they never went very far with it. But they could do that. They have done that a little bit with some vitamins and things like that. And again, I think that would be useful to just here's the A's, here's the B's, here's the C's. Just as we do, with health inspections with the restaurants and things like that. Okay, so I think in general I am much more in favor of providing information to consumers than making decisions for them.
Okay, well, great. Well, that's a good place for us to wrap up. Folks, my guest has been Alex Tabarrok. Alex, thanks so much for your time and your insights.
Always happy to talk with you, Bob.
Thanks, everybody, for tuning in. We'll see you next time.
Check back next week for a new episode of the Human Action Podcast. In the meantime, you can find more content like this on Mises.org.